So good morning, everyone. It is 10 a.m. I'm Ron. Thank you for joining me for our College of Health and Human Services Town Hall meeting. It's been 11 weeks, seems like 6 months since we were together. And we heard on a Friday, I believe it was March 13th, that we were going to be shutting down on March 16th, which was on the Monday. And we had a couple days to get our lives in order, packed up and moved, and work from home. It's been quite the period of time, and I appreciate you joining me. It's been too long to communicate, and it's really wonderful to see everyone's face. And I'm reading the chat here and there. I'm going to turn the chat function off because I'll get really distracted because I want to hear from everyone. But we are recording this meeting, and a couple of sort of rules of engagement, I guess. That questions have been submitted in advance through an anonymous link. We have some of those questions ready to go at the end of the after I present a little bit on the college, and then use the chat function to add questions. And we have Joe Kraus, director of our communications, who will be fielding those questions, curating them, and looking for themes, and then asking those questions. With so many people, it would be a little difficult to take individual questions, but I'm open to you emailing me afterwards or whatever to get more clarity or something, but we should be able to get at a lot of questions. I have a number of slides that shouldn't be longer than 20 minutes, 25 minutes, but I think it's things that we need to know, things that we've been through and how we've overcome them, where we're going to be, what our reality is, and what we can do in the future. So what I'm going to do now is share, I'll try to share my screen with everyone with some slides that I have prepared. And you should see them now. Can someone shake their head? Jill, Helen, I can see you. Okay, good. The way I'm framing this discussion is our response, the resiliency that we've shown, our realities and where we are, and then our relevancy moving forward. And I believe we could capture sort of this tumultuous time in a few slides. So I do want to take a moment of silence in memory of Mr. George Floyd. I sent out a couple communications. I've been working with Dr. Betty Dennis with our D&I, Diversity and Inclusion Committee. It's been real tragic what we've experienced, and I think the college needs to stand for equity, action, and unity, and we'll discuss those toward the end of the presentation today. But I want to take some time, a moment of silence in honor of Mr. George Floyd and the tragic loss of life. So I purposely took about 9 seconds to honor Mr. Floyd, representing, in essence, the 9 minutes almost that an officer knelt on his neck. And just think of that 60 times over, the amount of time that was, with other people not helping out, and the bystander effect that happened. I don't mean to take just a little bit of time, but we do have some business to do. I think it's important that we discuss some of the equity, action, and unity issues toward the end of this discussion. So the points to be covered are what we have done in response to COVID-19 and the immediacy of doing things differently, how we are recovering, and there's many examples of that. What will our reality be? What will our finances be? And then what will we become, understanding a different scenario for our college and the university? So we did an amazing adjustment to meet student needs. We converted 525 of 726 course selections or sections. That's 72% we converted from face-to-face online. Many folks never taught online, and they still converted their face-to-face sections into an online format. And we're so appreciative of the quick response, the support of our campus, and the support of IT, and the support of faculty and staff, other faculty helping faculty, and our staff helping in that process. Our student support services, in terms of our outreach and recruitment, I'm going to cover some of that, advising our students and making sure that as many of our students could be retained and be successful in their studies. And then the technology support to carry this all out. We had some virtual graduation celebrations that I was so pleased to be involved with. It was the Bronson School of Nursing, School of Hearing and Sciences, Speech, Language, and Hearing Sciences, and the School of Social Work. And they're wonderful, joyful events celebrating graduates of undergrad and graduate students this spring. It was wonderful. We have new opportunities of research and innovation and continuing education that I'll highlight in a second. We had amazing response even from our undergraduate students. The public health students worked with marketing and communications at a campus level on public health messaging. Dr. Lori Gray stepped up to provide mindfulness sessions on a weekly basis for a while. I don't know, Lori, if you're still doing that, but thank you. Bob Bensley sponsored the public health students, and they actually were able to publish the paper on the messages and the impact and reach of those messages across campus. So congratulations. Dr. Ravadas provided continuing education on health literacy to the Kalamazoo community. Dr. Hahn began student internships to get hands-on experiences remotely through the Health Services and Sciences program. Eris Huey began early on making masks for us, and she actually sent 3 masks for my family, which was just wonderful, and she continues to do that. Dr. Laura DeThorne, along with Eris Huey and Dr. White, Tiffany White, were instrumental in beginning Dr. DeThorne and then carrying out with Eris and Tiffany on a Why I Mask campaign, just showing support and response to our students and the rest of our faculty and staff. More on that Why I Mask in a little while. So I just wanted to bring up some other stories about our faculty, and you can read these. I'm not going to go through all of them, but some of our faculty driving around Southern Michigan during summer, I'm sorry, that should be summer 1, to deliver equipment to students. The entire inaugural cohort of 30 DPT students completed their first year. The second year students will begin June 15th. Our OT students, by the way, it's not in here. The first cohort of the doctorate in OT will be starting in summer 2. Clinical instructors moving to use simulation and telepractice. Faculty converting their homes into video production studios. My place at home is not a video studio in the least, it's a blank wall. College IT support, numerous WebEx trainings, transition to virtual. And even alum, as an audiologist from our graduate program, who rallied her fellow audiologists in the community to convert their practices and reinvent themselves in what they do. And these are just a few examples. So moving to resiliency. So that's how we responded to the COVID, and there's many other ways. As far as resiliency, it's sort of where we are, how we're picking ourselves up, and what we will begin to become and be as we start opening our doors. And so we have a lot of campus level and college level groups working already to return to work and return to a different way, but also making sure that we can provide the instruction, the research, and the service that we normally do. So So the public health response to our COVID-19 pandemic and the systemic racism that we're experiencing, have been experiencing for a while, but at its height, it seems, in our nation today. Working with the Diversity and Inclusion Committee, as well as the public health response by some of our public health faculty. The Academic Affairs Fall Contingency Task Force, and you'll hear more about that, but we have Professors Bensley, Ford, and Harrison from our college working on that task force. We have Professors Greaves and Singletary working as faculty champions with WMUX to provide further pedagogical support for virtual instruction. We have a summer teaching in a small teaching lab pilot provided by the Physician's Assistant Program in Dr. Aru, or David Aru, to pilot test how we can safely instruct our students in a smaller, tightly knit group. We have a CHHS Return to Campus Guidelines Task Force with a draft plan put together with Professors Aru, Fogarty, Kelly, Lagerway, and Lairla, looking at our use of personal protective equipment, students, faculty, staff precautions, building access, and so on. More of that to come, and we'll start sharing that. So don't worry that you have to create those things on your own. We will not only have them for the building, but we'll have that also checked with campus guidelines for returning to work. And then UC and Unified Clinics and Center for Disability Services have been providing some services during this time, but they have a plan as well that's being reviewed by campus for reopening and expanding their services moving forward. So thank you for everyone in your resiliency. Even in research, we haven't stopped. I've heard that some institutions have announced that they're returning to do their research. Well, we've never stopped our research. In fact, we've submitted 25 applications for external grant and contract funding. Pretty amazing, since March 1st. We have Alex Santos, who received a METER Presidential Endowment Award for working on a COVID-related project, and he is getting funding and will have students working with him. We have a FRACA award from the university to Maureen Mikas and Don Smith that was awarded during this time. Hope Gerlach was accepted among 200 applicants to a research training institute for Center for Global Health Studies and NIH. We had 2 internal rewards to Melinda McCormick, Alyssa Allen, and Pamela Wadsworth for an Innovation Team Award for their work in transgender and gender non-binary persons' experiences with health and human services provision. Maureen Mikas as well received an award for her forest-based virtual reality for reducing hypertension among African American elders. So congratulations on being resilient in our research. So here I start entering into our financial reality, and some of this you know. You know this from the president's discussion and the provost discussion yesterday, as well as Provost Bott and Jan Vander Clay's recorded presentation that they provided to our campus about a month ago now. So academic affairs as a VP area needs budget reductions from the general fund, and that's for our permanent dollar fund. This cut to AA academic affairs is from 385 million down to 320 million. So this amount of 65 million reduction is 20% of the full campus budget. However, when it comes to the colleges, we're assigned a 24.5% reduction based on our permanent dollars. These are across the board reductions. It's not strategic, but yet the colleges are meant to be strategic in their reductions, and I'll talk a little bit about that as much as we can. The 24.5% college cut is higher than the 20% cut that AA is expected to come up with, the 65 million. However, we've protected, in the AA budget, in the academic affairs budget, We have dollars for scholarships for students, financial aid for students, as well as debt retirement for our academic buildings, including the college building. I think we still owe $1.8 million, I believe, on our building, and it's what, 16, 17 years old, I'm forgetting. All part of the academic affairs budget that we couldn't reduce. So a 20% cut to AA meant a 24.5% cut to what we do and our people in academic affairs. So the permanent budget reduction for us, starting with an $18.5 million budget, is a $4.5 million budget cut. This is 24.5% of our permanent dollars. It's huge. It's about a fifth of our overall budget, and I'll explain that in a second. So our reality is that we have to look at areas within our college instead of the wider university. Although discussions are happening at the university level, as Dr. Bob mentioned briefly, on reimagining what our offerings will be across our university. When we're discussing positions, we should talk about the positions, not the person in the position, because it's so difficult, and I've had many discussions already, and it's hurtful. It impacts people, all of us, deeply, and we could talk a little bit more about that. And if we do not make our decisions, the decisions will be made for us, and I think it's best that we lead the way. All right. So our financial reality is really looking at the permanent budget. We have two ledgers. We have a permanent ledger and we have a one-time ledger. The permanent ledger every year is really the book budget that we have. It's the dollars we get from tuition, historically, through an incremental budget model, and which is made up, it's a dollar amount that we get in total, made up of tuition and state appropriations. It is historical. As you know, and I've heard before I even got here, but it's 16 or 17 years running that we have cut our budgets. We have taken cuts to our incremental budget. It's not incrementing up, it's incrementing down. Our share of the permanent budget is 18.5 million. So that's our permanent budget, and we need to reduce it by about 4.5 million. One-time budget reductions, and I'll tell you what that is in a second, decreases cash flow, so we have to be careful there too. In Jen and Jan's presentation, they said that if we operated the same way with our cash flow out, we would be out of funds in March of next year, March 2020. So we have to scale that back through limited travel, canceling or freezing planned construction projects, reducing discretionary funding, reducing part-time and faculty and staff, and so on. So here are our budgets, and I have a little, the messages are blocking my screen here, so I'm going to move those, sorry. So on the left, you see our total permanent budget, 18.5 million. Compensation is 94, almost 95% of our budget, 17.5 million for compensation. Operations is just under $1 million, and that's 5.36%. That's our reality. Simply put, that's how we run our college. If you carry over the 18.5 million into our total college expenses, you'll see that on the second row. That's the 18.5 million. We have a total expenses of 23.2 million, and you might want to know what that is. This is our one-time funding, and this is other revenue coming into the college. It's revenue from summer one and summer two. We have a strange model here at the university that depending on how well summer one and summer two is populated with students, we then get some of that funding back. We've gotten funding from EUP as another source of revenue. That will be changing with the SRM. We have research funding. We have continuing education dollars coming in. We have other ways of dollars coming in that are one-time funds that are not part of a permanent budget that we have allocated to us. So we have a total of about $23 million in expenses this current year. 18.5 is our permanent dollars and about 4.7 million in one-time dollars. Oh, I'm frozen here. Okay. So here is the look at where we spend our money. Again, the $23 million is the total on the bottom. We have some categories of people and activities. I just want to highlight a few of these. If you look at the total instruction, I know I'm using a little bit of a loose definition of instruction because I have GA and DA allocation in there as well. I know not all of that is our TAs, but there are support for our graduate students. And if you look there, we spent about 17 million of our 23.2 million, or 74% on instruction. Now, instruction, that's loose too. There's research in there too, right? Our professors are also are responsible for research and service. Our academic unit administration and staff, excluding CDS and UC as an auxiliary unit, 29 people and about $2.6 million, or 11.57%. The Dean's Office administration and staff, 22 people at about 2.1 million or 9.2%. Supplies and equipment, very little, 1.1 million at about 5%. So that totals the $23 million. This is how we're spending our money this year. We do have a reserve account of $1.2 million, and now my face is in the way of the percentages in the lower right. That's 5.52% of our budget of our total expenses that we have separately in reserve, separately. Now, you may think that's a lot. It's gone down over the years as our budget has decreased. I believe last year was 1.7. We needed to bring up to speed our IT, our facilities, and other things, renovations, with some of those dollars. We were way behind in upgrading our IT. Ask John Stanford about that. I'm projecting for next year to have about $786,000 left, which is only 3.21% of this 23 million. It'll be more when we reduce our overall budget though, maybe about 4% on the margin. That's not a lot to run an enterprise like a College of Health and Human Services. And I'm stuck again, so I'm going to try. So I'm going to try to, so here is, I was asked as responsible for the College of Health and Human Services to come up with a draft budget cut for our college. All deans were asked to do this. We were asked not to be very careful in how we went about it, engage folks where we could, but also know that these are very sensitive times and we had to do the best we could to keep maybe some of our plans or some of our decisions as close to the vest as we could, because of there's so many uncertainties, there's so many unclear aspects of what we do here at the university. And I'm going to discuss a little bit about that. But here's our $4.5 million cut. We had some vacancies that came up to 859,000. We had planned faculty retirements, many planned faculty retirements before COVID came along, before the announcement of a faculty retirement incentive, adding up to about $1.8 million, 12 people. We had planned faculty resignations or resignations that have come recently. That adds up to about 600,000. We have potential faculty separations on the order of maybe $1.1 million. I can address this in a little bit. It's It's probably where the most uncertainty is in this budget. I put through an administrative staff cost reduction of 22%. Now, we were charged to come up with 25% reduction of our staff compensation. We came up with about 22%. These are not all positions. It's not 22% of positions. We were able, I worked very closely with the chairs and directors who are amazing advocates, if you don't know that, of your faculty and your staff within your departments and schools. I worked very closely to strategize, to really find out how we can cut upwards of 25% of our costs related to staff. We came up with 22% about, and it adds up to $492,000. It's a mix of, yes, unfortunately, having to let people go and reducing staff time. There's administrative savings and maybe some savings related to realignment. I can't go into detail about that because it's confidential, but I will bring up ideas about how we might want to realign our college to be more efficient after we're making these administrative staff and faculty cuts. And then an operations reduction of about $80,000 to come up with a total reduction of about $5.4 million, but knowing because of accreditation and our needs for instruction to hire back faculty. I do have to say that the potential faculty separations is where we don't know yet. We have the month of June for people to decide if they care to separate and retire and take advantage of the incentive to retire from our university and our college. Without knowing who's going to do that and how many people might choose that option, we don't really know how much we will be cutting in that area and how many faculty rehires we will be able to do. We just don't know. That's the big area of unclarity, and we will know more by the end of June because that's when people have to take advantage of the incentive for retirement. So a lot of people, when I sent out my email a couple of weeks ago about relevancy, I think people maybe misinterpreted it. I'm not surprised, but if you ask me, all of our programs in our college are relevant. I say this oftentimes, and when I greet people here or speak at engagements, that we are preparing our students for careers that are high in demand in almost every fashion. Our workforce needs in our careers are well above the national average of 7% in the next 10 years of growth. We're more in the 15 to 30% growth in most of our programs and our disciplines. They're all high in purpose and meaning. They're high in satisfaction when people and our students and our alum are out working, and they're unsurpassed in impact in every shape, way, or form. We are relevant because we provide quality instruction. We meet our accreditation requirements and standards. We have access for our students in ways that is unparalleled across our campus. We're going to be looking at faculty instructional workload. We need to look at commonalities across our college and across the campus. We have to look at faculty to student ratio, class size. We have to look at first-year experiences of our students, the student experiential learning and internships and placements that they have. And we have to look at hybrid approaches. We are already implementing aspects of holistic admissions that are diversifying our student body. And it's amazing. We have some great successes already. Our advising student success and professional development program, well, we didn't do much. We've always done advising. We've done not so much in student success and professional development, and students are asking for it. They're hungry for what can we do to help our students succeed at a time when oftentimes students are lost when they first walk in the doors and throughout their time here. We're student-centered. In advising, we had 500 check-in calls. We talked to transfer students, check-in appointments with our students. We are looking at the university level of a 1WMU and centralizing some of the advising, but when students are in our specialty programs, we need to be with our students. We haven't put much in the past into recruitment. We are heavy into recruitment, marketing, and outreach, including communications and continuing education. We are making phone contacts, texting for the first time, doing some mass text. We're trying to get approval for more. College fairs, grad student calls, emails, faculty engagement and recruitment and outreach, serving our community through continuing education and so on. So here's some student quotes on, and I'm not going to read these, and then I just have a few slides to end. Here's some student quotes about what professional development and how we focus on student success in our programs. And these slides can be available for later. So I just want to give a little bit, these efforts are working. These efforts in outreach, communication, recruitment, outreach, I think I said that, are working. If you look here, I'm going to try to summarize this the best I can. We are a little bit lower, well, a lot lower actually in summer one, head count and student credit hours than the university, although we held our own from last year. So we held about the same, but summer one was up across campus. So we were a little bit lower. Summer two, it's lower right now. It's too early to call this. It's too early to tell who will be showing up. But we're about the same as our campus in terms of projecting for summer two. For fall, we're actually higher in our efforts for recruiting for students for fall. About the same in both head count of students, number of students, and student credit hours, whereas the campus is down about 6.3% in both. Projecting is very early to tell. So here I just summarized, our early enrollment is at 2,000 students about, we're down about 0.6%, where the campus is down 6.3%. Early on the student credit hours, we're at about 20,000 student credit hours, a little up, but campus is down. We know that we are third out of our 8 colleges in the student credit hours per FTE. We're fourth out of 8 in students per tenured track faculty. We're 5th out of 8 in students for all faculty. And I think our college is right sized. And you'll look in 2019, we have about 13% of enrollment, 13% of student credit hours, and 13% of the faculty at the university. So if we had a $14.5 million budget, book budget, perm budget, not 18.5 million, what would be important to us? What would we build? Would we approach health and human services through health equity lens, through social justice? Would we look at a continuum of prevention, intervention, rehabilitation? Do we serve individuals to families, to communities, to full populations? Would we look at health and social service across the lifespan or a life course initiative of health? And would we want to build something like resiliency for children and families? I think we would. So I want to throw something out there, and I believe, yes, this is my last slide, is that we might look toward realignment in the future. Realignment takes a process. We need to probably realign already with our administrative staff, and that's what the chairs and directors helped me with, was how could we keep some people here and share across units, and maybe keep some people here if we reduced some time for others who may be on salary, for example, versus hourly, and even some of our hourly employees. We also might want to align with our disciplines, realign into a school of healthcare sciences, a school of interprofessional health and rehabilitation sciences, and a school of population health and human services. There's a business case for it. There's considerations, both barriers and strengths. It's something that I want to put out there. And then I want to follow up sometime this summer, maybe in July early, to have a town hall to discuss a realignment of our programs, our disciplines, our schools, departments, staff, and so on, and leadership. So I leave you with this, and then open for questions for about an hour, not quite. I would like to have a town hall about potential realignment using that framework. I would like to attend, and I will actually tomorrow, the first one right after this town hall, over the summer to meet with faculty in faculty meetings. I would like to attend administrative staff meetings I have in the past before COVID. And I'd like to just give you a quick announcement about why I mask event, and allow me to do this. I don't know if you can see this. Can you see that? The campaign was started by Dr. Laura DeThorne, and we are with the help of Eras Huey and her son, who has made a number of masks. We will be having an event on Monday, June 8th, 10 a.m. to 1 p.m. I hope I have that time right. We will be at the CHHS building at the bus loop area. You can pick up a mask. You can take a photo op with the Why I Mask picture by you, and just to say hi. We will be in our masks. We will practice social distancing, although we can gather upwards of 100 people outside if we'd like to. So please, with that in mind, I'm gonna turn off my screen and then open this up for discussion. And welcome back, everyone. I can see you again.
Okay.
So, I do want to say that Joel is going to help with some questions. It would be a little bit hard to take questions from everyone. Bear with me on this. I'm willing to take other questions. Actually, I've received a lot of questions from you all in the past, recommendations from you all. Joel is curating. He's gone through some of the questions that were sent previous, and then he'll try to go through that chat. I have the chat off because I would be fully distracted by comments and questions. So Joel, and thank you everyone for attending. Really, thank you for your patience. It's been a tough 3 months, a really tough one for all of us. I appreciate everyone's effort. We've done a lot at the campus level. No one wants to be in this position. It's really tough. As much as I can be there for you, I will, and I'll try to answer your questions now.
Okay, thanks, Dean Cisler. So for right now, I've got a list of questions that came through the Google Docs form that we put out there last week. The chat's been pretty quiet. If anyone has questions to add through the chat, trying to monitor that as well. I'll answer that question, Dennis. Yes, we'll put those slides up on the website. We'll make it available with the recording of this. We'll make this all available on the website and let you all know. I'm just going to try to sum up some questions that came in, and if you have others, obviously please make them, and I'll try to watch both of my screens and get through them. So Dean Cisler, enrollment projections for fall actually look good right now. Can you speak to why we are making such drastic cuts, and can you speak to what will happen if enrollment, with what numbers actually look like in the fall?
Yes, enrollment, it is encouraging. We are up on commitments, I've heard. However, it's so uncertain. We don't know what students will do. When given the opportunity, if we indeed have the opportunity of coming back on campus, first of all, there's a couple things with coming back on campus. It will be different. We're gonna, as Dr. Bott already discussed, and we're working on this over the summer, the structure of the semester is going to be different. Even the number of months that we will be open will be different. We might even, I don't know if you heard, after Thanksgiving, not have students come back. Try to get everything done before then, because when people go back home, there's risk of coming back if there's an outbreak or if there's any exposure to come back on campus. So we might ask students to stay as much as possible here the full time, if we even do come back. And we're going to be coming back different. We're going to be coming back with social distancing. We're going to be coming back with paths of indoors versus outdoors in our building. We're going to be coming back with 1/3 to 1/2 of the students in any given classroom. We're going to be maybe asking for people to do most of what they do online in the lecture part, and then come in for some of the hands-on activities distributed a little bit with the number of students as part of the week. It's going to be new and different as we prepare for fall. Then we don't even know, once given the opportunity and the clarity on how we're rolling out our semester, whether students and student families will be making the decision of students actually coming and enrolling or taking back their registration to our campus. We don't know. We're preparing for the worst. The other aspect of it is we already were down. Our college is doing well. The summer went well because it was all remote. But if we roll out into on campus, we don't know what's going to happen. So we're preparing for the worst. So our decisions in perm dollar cut and people leaving or reducing time early on will be, this is what it is. If there's opportunity, there's a process for maybe rehiring, and that decision will be made later. I hope I answered it, Joel.
Okay. So we've had, there are a number of questions about the hiring freeze and how layoffs and retirements and are impacted, as well as how part-time instructors fit into how they're affected by the hiring freeze.
Okay, so I can talk both from a staff perspective and a faculty perspective. With the faculty, people probably know pretty well the AAUP guidelines. There are protections for the people who are tenured. There's protections then for people who are untenured, both in our traditional faculty and faculty specialist ranks. There are fewer than protections for our junior faculty who are not tenured, and even further for those who are just beginning. And it's all based on seniority. There are fewer even still protections for term and part-time. And so you might imagine that that's the way we would need to move forward. Now, I shared with you that there are planned retirements, there's planned separations, and there's the incentive available for retirement moving forward. We will know more in the month of June. As those become available, it will impact what we have to do in layoffs, and it will impact what we do as far as hiring back term faculty and part-time faculty. Right now, and it started already with summer one, if you don't know already, you probably do because you're working with the chairs and directors, any part-time and term faculty have to go through, we have a hiring freeze, but we have to go through the process for an exception. And it's a form that we have to fill out. These forms with the exception to hiring for summer 1, summer 2, and now fall have to go through our unit. VP unit is academic affairs. Academic affairs reviews them, asks questions, verifies whatever. Then those go to the president's office, a team made up of 4 VPs who then reviews and makes decisions. So that will be our process moving forward.
Okay.
Oh, and I'm sorry, I had a category that was, I just remember, it says faculty separations, potential faculty separations, because that could be in the form of retirement, or it can be in the form if there are not a lot of folks taking advantage of the retirement incentive, then we will look for other separations, and that means junior faculty. That means terms. It means junior faculty. And that is based on Article 25 of the AAUP contract.
Okay, thanks.
Oh, when it comes to staff, I can address staff. Staff, there is a seniority. There's also seniority means a lot. Actually, it means a lot because if some people are laid off and they have more years, they can what's called bump other people at the university for a position in the same category. That can happen. So seniority plays a big role. There's also, when we talk about notices for our staff in the staff compensation system, depending on how many years you've been here, will determine your period of time of notice of your layoff. So for example, I could take an extreme example. If you're here over 20 years, we have to give that person a 1 year, 52-week notification period. If they're here for less than that, maybe 10 years. If they're here for less than that, it's based on the number of years of seniority in a position. And again, I want to also emphasize there's the bumping possibility for staff across the university in a common position line. So I hope I addressed that fully.
I'm seeing a lot of timeline questions. I think you spoke to to part of this earlier, but we're interested in knowing when there will be announcements on retirements and the layoffs in general.
I can address that. And first of all, and this is going to be tough. And first of all, with the faculty, we have to, the whole campus, we have to figure out in the month of June, we need to figure out the number of faculty, the people who will be deciding to take the retirement incentive and separate from the university. That will go a long way of figuring out what we have to do as a university. These are extremely drastic cuts. So that will go a long way. So the month of June will tell a lot. With staff, I don't know if anybody has heard, but I've heard that some of the vice presidential areas like business and finance, the president's office, the athletics, other areas have already done their layoffs. Academic affairs is the largest unit on our campus. It's as Jen says, 74% or 74% of the campus is essentially the budget and people are in academic affairs. HR, I've given my recommendations in work after working with the chairs and directors. My recommendations to the provost, we balance between actually losing full people and lowering amount of time. So lowering FTE, I think we did the best we can do in strategizing with our chairs and directors. I gave those over to the provost about a week ago. And the provost has sent, as of yesterday, I believe, has sent or end of the week, last week, sent recommendations over to HR. HR is now moving forward with what's called a reduction in force plan. We've asked as deans to have a notice period so that we can talk one-on-one with people. And this is not the way we've ever wanted to do this. It will be remotely. But we've asked for that opportunity well in advance of any notification. I don't know how long that lead time will be. So as soon as I know, I'll work with the immediate supervisors, I'll work with the chairs and directors, and I will be speaking with people.
Okay. A little bit different direction. Between COVID-19 health matters and now university budget and staffing issues, it sometimes feels like there's been a vacuum of information. Can you speak to the openness and transparency of the university's response?
Yeah, it's been, the first thing I have to say is asking for grace. No one planned for this. It's hard to be strategic when we're all, look at the nation, 35, 40 million people unemployed. What is it, a 30% unemployment rate? The universities across our country. I've heard reports from some faculty, it seems as if the WMU is being hit really hard compared to what other people have shown. And so I struggle with this transparency or not question, because I challenged one person who told me that. I said, well, I wonder if people know there. I wonder if it's been revealed. One thing that was transparent, I think, early is the $45 million to $85 million range for this coming up fiscal year. That was said early. Other universities were hiding behind. I talked to colleagues at my former place. Oh, we're talking about an 8-9% reduction. Well, that's changed remarkably since the last time we talked. There's reports of other universities in the MAC. There's reports of universities in the Michigan system that early thoughts were not what they're undergoing now. For example, there's a university about an hour up the 131 that early on it was fine, everything we're going to be able to handle. Now their expected reduction in budget is larger than WMU's. So larger than that projected 85 million. Michigan took out a $1 billion loan before anticipating, before the now poor credit rating of higher education across the nation because of what we're going through. They got a $1 billion loan in advance to help what they have to go through with COVID. Shutting down for 3 weeks is huge. Planning to be different in the future is huge. I think in the best way possible, we've been transparent as far as the worst case scenario. Hopefully it won't be there. I asked for grace on that and for our leadership. we never thought we would be in this position 3 months ago. It's hard to be strategic when you're reeling, when you're trying to make sure the university survives this. A little anecdote, I grew up in a smaller town in Michigan, listen to me, Wisconsin. Now I'm making a mistake the other way, which is amazing. So I must be not a Michiganite, a Michigander. I was a Wisconsinite. There's a small college where I grew up of about 200 faculty and staff only, small private. They just announced closing of their doors after 78 years, I believe. They're closing their doors due to COVID in July. It's pretty remarkable, the impact. I think in a way, because we were able to move on a dime and to convert to remote, like we were so nimble. It was wonderful in the instruction aspect. But even some of our staff were asked to cut their hours, right? And the university provided COVID hours, double of what is provided through federal guidelines, double the COVID hours for leave. We've been able to, in a way, put a Band-Aid on it for these few months. And now we're in a position where we really have to look deeply, and that's where we really need your patience and your understanding and your grace. And we worked hard to do strategic cuts the best we could, so that we could maybe lower FTEs, number of hours worked, versus cutting people, particularly our staff.
What do I want to ask this? So we are, the university is in the middle of rolling out a new budget model. And you indicated in the presentation that our college appears to be right-sized. Can you speak to situation at other colleges or other units across campus, as far as how these cuts fit in with that, or fit in with the new budget model?
So absolutely, and I'd go back to that one slide that I had, that were high in demand, high in purpose or meaning, high in satisfaction, and unsurpassed in impact. What that means is our careers that we have here, that we are preparing our students into professions, are amazing, and we will survive this. Before COVID, as we were rolling out projections, these are just, trust me, they're imperfect numbers. We were going to be, early on, it was going to be about 3.5 million in the positive as a college. That means that with state appropriations and with student tuition, our costs are less than what we bring in. We're in a great spot, 3.5 million. Some other colleges are 3.5 million in the red. One large college is 18 million in the red. One not so large college, but because we are a nation like this, business is 18 million in the positive. So what was going to be happening is, after we meet our expenses, we would have to subvent another unit, another college on campus, or colleges. So that puts us in a good position pre-COVID. Now, we all got across the board cuts, 24.5% cuts for all colleges. In a way, to me, we're going to be the same, only 24.5% fewer dollars in an incremental budget as a base support for our college. To me, we're going to be in the same spot with the other colleges. We're going to be in the positive. But we have to do it with $4.5 million less. So our challenge will be accreditation, students, making sure that we can roll out what the students want. And I'm going to pick on a small program here, but it's illustrative. It's very illustrative. We have ASL, which within our speech, language, and hearing sciences. It is a program that many students from across campus are taking. So they want it because it satisfies a language requirement of the university. We make money from that because we're the College of Instruction, more than what we have for our costs. Well, to me, the university I would not want to close down that opportunity or that program if it's serving a need, a high demand need, and it's doing well financially. That's a small example. Well, we already have started. The chairs and directors have done their own thing, but we've provided at least some indication of where the departments and schools are within our college. Some schools and college or departments and schools will be subventing some others. Our hands-on rehabilitation and graduate programs, some of those are very expensive. But we have other ways of helping to subvent and to be 2.5 million in the positive. We've already promised as chairs and directors and leadership to work together. We're going to get closer and closer to not an estimate anymore about where our revenue and expenses are. And I challenge us that if we look in a SRM lens for a year, by the way, from July 1st coming up, so 11 months from now, we will be in the SRM. We will do a side-by-side with our historical model and the SRM. Colleges will be held harmless during that time, but then we're going to institute the SRM in full force after that. I challenge us to think about how we might realign so that there is not one school or college that is subventing the other 8 schools or departments are being subvented by one. That if we distribute some of our programming and disciplines, realign, maybe we could have a good, solid framework for healthcare sciences, interprofessional health and rehabilitation sciences, and population health and human services. If we realign something like that, maybe our SRM could be a flourishing model that helps distribute and lift our programs in our college.
Okay, changing gears just a little bit. Can you talk about what's going to be done to protect the health and safety of faculty, staff, and students when we return in some capacity during the fall?
Absolutely. So number one concern, and that was part of the response as well, safety. If I didn't mention it, the fact that Governor Whitmer, the nation, and our university stayed at home was for safety purposes. How we come back is going to be critical. We have a return to campus task force. Jennifer, I don't know if I see Jennifer Harrison, Bob Bensley, Yvonne Ford, are part of subcommittees on how we come back with instruction in particular, including different formats, including different timing of when we offer our in-person or not. The call hasn't been made yet for fall yet, what we're going to be doing. I'm sure we're going to look at a lot of hybrid, maybe because everybody's used to it now. We have most of the lecture stuff online, and then we have fewer people coming to campus, but hands-on for fewer students at a time. There's a handoff was made under COVID from some VPs and the president to other VPs in our resiliency phase of coming back. Kara Wood in government affairs under that VP unit, I believe Jen Bott, and the director of public safety, and there's one other, oh, and Syndicus director are working on coming back to work plans. Our college has also put a draft together for coming back to work. What will it look like in CHHS and EWB? How will we test? How will we screen? How will we provide PPE? How will we try to monitor social distancing? How do we keep our students and our faculty safe? Are there some faculty who are not comfortable, and staff not comfortable in coming back? Is there a way that we can have a different work from home, remote work platform coming forward? All of that is in discussion. How do we assure accessibility for people who have accessibility needs coming? And I know I'm not probably saying that correctly, for our building and our campus. I've just talked with Dr. Tiffany White and Jane Fraley Burgett yesterday about these issues and incorporating that into our plans. So we are coming up as a campus and as a college with some plans. We will share them as they get enough input and in draft form. We are also mass buying PPE, masks, shields, gloves, and other things through, we can get a better pricing through purchasing procurement. So we're looking into that so we're prepping, we're being resilient, we're prepping right now for all of that. Also, if someone has a concern, please share that with your immediate supervisor, your chair or director, or with me directly, please.
We got some questions about student employees and GAs, DAs. It's been indicated that the allocation is going to be reduced up to 60%. And some units already have commitment letters out to GAs, DAs. How will this and other previously existing positions be dealt with in the coming year?
So the academic affairs took essentially a 24.5% cut because we're trying to protect most forms of student support. GAs took a 20% cut, not a 25, a 20% cut, so a little bit less percentage of a cut. However, with the proviso that most of the TAs, as many TAs could be affected or helped, not affected. So when that rolled out to our college, historically, we haven't had a large number of TAs. Well, never has it been revealed how important it was to have more TAs in our college than when we took a cut. Because in protecting TAs in other units, let's say the College of Arts and Sciences, and those are doctoral students typically, right? And those are the ways to actually get doctoral students to come here. What happened is we got disproportionately impacted by the GA-DA reduction. And so our cut was 60% of our GAs and DAs because we didn't have proportionally as many TAs. We have very few, in fact. Part of it is because we have fewer doctoral programs here, right? And fewer doctoral students. We have our interdisciplinary and we have some new and some doctoral programs in audiology. Well, audiology is not new, but new in physical therapy, and we're starting the doctorate in OT. usually that's not as much of a concern in the professional doctorates as it is in the PhD programs. So we did not have a lot of TAs. That hurt us. We're trying to see through our one-time funding that we can keep undergraduate students and student hourly, of course, as much as we can. There has been some creativity, though, I have to say, in the CHHS program. They've lost a few of their funded doctoral students, and they found a couple of sources for funding the doctoral students from some of their partners in the community and across the state. And they've been able to maintain some of those doctoral funded students through that creative funding. But it is disproportionately hurting us because we didn't have a lot of TAs in the first place. And others as well, education, a little bit in engineering and business. They lost all of theirs. They didn't have a lot in the first place. They don't have any GAs and DAs now. It's unfortunate.
Ron, we're getting some questions in the chat about showing your slides, your 3 alignment areas again. And I'll say again that we'll put Ron's presentation up along with the video from today, and I'll send that out to everyone by email this afternoon.
Yeah, we can definitely share this. These are initial thoughts. I actually put out where we could put what, but I didn't want to hinder creativity. These are my terms. Some of the chairs and directors and actually faculty kind of actually beat me to it and put in some of their thoughts about realignment as maybe a solution to the huge budget reduction that we have. This may or may not align with other people's input. I'll take full responsibility and blame and no credit or whatever, you know what I mean? But this is something that and there's some provisos on the bottom, a case for it and some considerations. There are some restrictions probably of any college, how we can realign and save in administration because of our accrediting bodies and the requirements that accrediting bodies have for leadership in certain disciplines and programs. We know those. We have done a lot of work on pulling those together and examining them. There are some barriers. But I like to see just if we can really have a creative discussion. I do want to say there's a process for this. We have to get input from faculty, staff. We have to go through the faculty senate. They have guidelines when it comes to organizational changes of an academic unit. It's something that we can't just do. But we can, what I did is I tried to populate the budget cut with some possibilities and in coming up with realignment. And actually, I don't know if this is a formal question out there, but some people might ask, well, what are you doing in the dean's office? Well, a couple things with that. First of all, I might have said in previous discussions, we're very thin in the dean's office, and some may agree or not. I'm taking my previous experience as a benchmark, but we are cutting our dean's office. We're going to be working hard with a lot less. I'll put out at about the 30%, whether you talk about number of people or really the cost of running The dean's office, we're cutting it at about a 30% clip, and that's my estimate. We looked inward.
So I think this is revisiting a question, Ron, but there were, it came in the previous questions is coming in the chat. Once we know about retirements, faculty retirements at the end of June, do you have a sense for how long it's going to take to know about faculty line reduction at that point?
Yeah, we'll know. That'll be real clear then. How soon I communicate, I have to have a little bit of time to understand what it means, work with Tiffany, our business manager, work with the chairs and directors. We have a fairly short turnaround, as you might imagine, because fall's coming. Even if we have to give notices, then we know this, the cost, there's a time we have to give a good amount of prior notification to people if we do faculty layoffs. It's required by the contract. We will abide by it. We don't know if we'll be there. I'm hoping we won't, but I can't tell where we're going to be. It's not up to me. I will try to get that information as quickly as possible. It will also be needed because we'd have to plan with our chairs and directors for coverage of our instruction. So we will move swiftly early July. And we'll have some indication. I'll have some indication along the way, I'm sure. I just don't know if it's fair to, I'll work with the chairs as far as coverage though. One question that I got in totally independently, it was kind of controversial out there. I think one of the deans was misquoted, but there was a sense that if a person retired from a specific unit, whether that be a department or school or program, would there be an assurance that a replacement person would be put in that position vacated by that retirement? We can make no guarantees. It helps the overall scenario of our college and the university, but all positions moving forward in summer 2 and in fall are going to go through this review, this exception to the hiring freeze. We have to justify everything. We also, we don't know then, we still won't know how many people may be taking the incentive plan for retirement collectively. But we have a collective budget to cut as a college.
Okay, sorry. As the governor's stay-at-home order continues to evolve, do you have a sense about when we'll be back in the building? Do you have a sense what that looks like with student workers?
Nice. That's got to be. I do not have a sense. I do not. I don't know if you can tell, I'm in my office now. There's been a couple people here, we're using our masks. I'm only here, by the way, because I have low bandwidth at home and I didn't want something to happen where I couldn't have this discussion. I do not know. Like I said, we've been piloting, even within our college, return to our building. We're going to be piloting in summer 2 with PA. There has not been a decision made. Some universities have made a decision, but then qualify it with, well, depending on the stay-at-home order. The stay-at-home order has been relaxed, but not for the number of people who can gather indoors. That's still very restricted, and it's restricted to certain businesses. I think those are being relaxed. We don't know what's going to happen yet with the university, and we don't know when the call will be made for opening facilities widely to faculty, staff, and students for fall.
But you're saying.
Are there a couple of, I guess, workload questions? You know, is there a defined workload increase? We had a question earlier, previously submitted about, you know, workload related to retirements or planned retirements and people making workload adjustments.
Sure, I can discuss that. So workload is not being increased for faculty. Workload is going to we're going to the request priority from academic affairs is for workload to be adjusted, with instruction being at the top of that workload. If people have a research buyout, funding or contract buyout, continuing ed or research or even a contract of some nature, we will honor those. We still want research to occur. Service and research, though, may need to be reevaluated in light of more need for instruction. That will depend on the college, on the school or department. Many schools and departments already have a process for reviewing workload. I would think that instruction is a priority, and then justification for release for other things needs to be done as an exception to that. Now, there are department policy statements, but we are at a time when instruction is high priority, especially with some of the reductions that we may have in our faculty. And this is in line with what Jen's notification that went out in her discussion yesterday. Dr.
Said, but here's what she said. They're very concerned and they want to get to the bottom.
There's someone that I can hear that's not muted.
Kathy, you can mute Kathy, but no one else can.
Sorry. I think I just did. Any other questions? We have about 5-6 minutes. I want to respect everyone's time. 7 minutes.
There is, let's see, COVID-19 has had a disparate health impact on populations of color and is projected to have similar or worse financial implications. Do we know how the projected loss in terms of student employees, staff, and faculty, and the implication of that disparate impact is going to have on these groups as a result of university budget decisions?
Yes. A big driver in all of my research, in the last 20 years of my research, a big driver for health disparities, in addition to things like marginalizing people, is economic and where people live, socioeconomic status, education, poverty. what happens then is our most vulnerable populations are impacted most with things like a pandemic. There's disparities in health, education, economics. We've made strides at the university lately on employing people of color. When we're dealing with seniority in making decisions about people, that unfortunately can impact people in a disparate way. I do have to say, though, that when we looked as chairs and directors, worked with me in looking at staff cuts, we kept an eye on that. We also acknowledged where people have a different strength and where people had different responsibilities and tasks so that maybe it didn't impact us as much. We also looked for reducing FTE rather than a full cut of a position. When it comes to our faculty, as Jen said and Dr. Bott said, Provost Bott said in her discussion, I think she touched on this a little bit yesterday, or if not, we talked about it maybe in Provost Council, that seniority, yes, has to be looked at with AAUP, but also specialty area needs to be looked at. Concentration, expertise can be looked at when we look at positions. We have a firm commitment to diversity. We need to do better, actually, and we have a firm commitment.
So Ron, I think I'm through most of the questions, the big questions that came through beforehand. What I'll suggest is that we'll keep this forum active going forward, and we can, you'll be able to respond to any other questions that come in individually. We can also post them on the same page where we're going to post this video and your slides, so that we can keep this conversation going beyond this call.
I think I just saw, no, I'm not looking at the overall chat, but there was I see a little bubble come up, and from Yvette about workload. Is there something more I can say about that, Yvette? Did you see that question?
The question that came in is, can you speak to the workload issue not changing? There are 12 credits of work, which could all be teaching. Will that eliminate research and service?
Right. Well, I consider this instructional capacity issue, Yvette, and others as temporary, whereas the budget cuts are permanent. We're asking for as much as possible for people to be fully deployed in teaching. There are exceptions to that, and that is something that should and must be worked on with the chair and director, and ultimately with me, and ultimately with the provost. But we're not increasing the 12. We're redeploying the 12 to teaching, if you will. And this is temporary. It's to get us through this period of time. It's also to get us through not having maybe as many dollars going in our one-time dollars going away from the university or in contract, under contract with other folks. Again, temporary. We're still a higher research institution, That has not been backed off on. I know this part is temporary. Amos, you're upside down. I'm sorry, I see Amos and he's upside down in my screen. Well, in ending, and Joel, maybe we could leave the platform open for further questions and then we could pull those together. I don't know that I'm going to be able to respond to everyone. But in closing, thank you so much for allowing me to discuss the brilliance of our college and what we're doing and how we've supported our students. I am encouraged, I'm positive with the numbers moving into fall. We don't know. Prepare for the worst and hope for the best. And I appreciate everyone joining me and us all this morning. It really was great to see faces pop up on the screen and see many folks that it's amazing how long 3 months seems than it really is. So thank you again, and I'll hope to engage again in July for sure. Maybe we'll know more by that time as well. Thank you, everyone.
Thanks, Ron.